Welcome, Wakefield, and thank you for joining us at our weekly COVID-19 updates. I hope that you all had a restful and safe and socially distant Labor Day weekend as much as people can. And I do thank you all for coming on this morning. Doug Lyons is on assignment today, so he won't be joining us. He's out of the district. But we do have a distinguished panel. We have our health agent, Elaine Silva, who just jumped off the camera. Here she comes. And actually, I'm going to start right with Elaine, who is very busy and has some other things to do today. So we're going to let her start us off. So Elaine, we're going to you.
Hi, good morning, everyone. This may be my last COVID meeting with you. As you know, on Monday, our new director, Anthony Wu, will be here. I hope to be with him on the meeting next Friday to get him going. To let you know, our cases are up. We were up 6 cases in Wakefield this week, which wasn't too bad. And that was a total of 49. We're seeing high numbers of testing, even with the holiday. This past week, there were some testing centers closed down on Monday. We will see an increase in testing due to school opening. So we're seeing a lot of families. We're seeing a lot of people return from vacations. We're seeing still the breakthrough cases. These are people who are fully vaccinated. They're people who are getting cold symptoms and are going to be tested. The thing is, we will be this weekend, starting today till Sunday, our main reporting system, the Maven system, which all the results go into, will be shut down for a big, huge overhaul. I think it's hopefully going to clear out some things that have kind of made everything a little bit slow. And with that, we will not be able to get in or have any access to it. So it kind of slows us a little bit because, you know, people think the weekend we're not doing anything, but on Friday night at 11 o'clock, we're getting cases in, and believe it or not, one of us is always checking a computer. So we work all weekend with it. So we're just a little bit nervous with that coming in late on Sunday as to looking through what comes through and then being able to notify those people as fast as we can. So we ask that you have a little bit of patience. You probably next week will see the numbers will be very, very confusing because of this. You may see some that were done on the weekend results not come in until Tuesday or Wednesday. We do expect a big surge again of testing, which can slow. But even when you look at the testing, you're probably having over 2,000 people being tested, and you may be getting 40 something positives out of that in a week, which is a good sign in a way. We also ask that you be very patient with those in the medical field. Hospitals, nursing homes, doctors' offices are very, very busy and very, very under a lot of pressure with this new type of surge. They're short-staffed just as well as everybody else. They're a business also, unfortunately. And to the school departments, they get a lot on their plates this week, initiating new testing systems, getting children back to school. There's lots of things that have to get done the first few days, and these nurses are working very, very diligently, and so are the teachers. So we just ask that you have a lot of patience. And a little bit of patience with us, just because it's COVID. There's other cases, other things that happen in public health. I have that happen this morning to me. So that's why I'm kind of like a little bit running around to do a few other things to catch up. But we're looking forward to something. There's more and more vaccines, and more and more coming in, they claim. We're hoping that, local health, we have looked into, seeing what we could get if it's possible, but the list is long, and whether or not the state would allow local communities to have this extra vaccines. And in regards to, everybody wants to know about boosters. Boosters are going to go to the immunocompromised and to those who really need them right away. So you may not see them again for another month. And we haven't even heard of anything anywhere having them right now. And it is going to be flu season. Flu season has started, and flu clinics will be coming up. So you have to be a little bit diligent, and we will get to everyone that we can. And we just hope you all stay healthy out there. Just try to do what you can. It's not easy. Remember, we live too. We're out in the community, and we're going places and doing things too. And you have to be very vigilant. and assess that situation that you're going into. Think about where you're going and what you're doing. And if you think you're at risk, you mask up, you wash your hands, you stay your social distance, and just try to do the best you can.
Thank you, Elaine. And I know that been in constant contact with the superintendent, and I know he was very interested in doing some testing at the school, test and stay program and the symptomatic testing program. And unfortunately, the state has not supplied us, as most communities, without that testing. And I know that you're working hard to make sure that gets in. So that's the parents, bear with the school department. Don't blame them. They haven't been given the supplies.
It's not us. Melrose started a week or so before you, didn't have everything either. And yesterday I received a couple of calls from different communities asking me, do we get it? Why is it? It's a very, very slow program getting out there. And unfortunately, everyone is working in every community, and we want every community to have it because, you have to have those around you. You have to surround yourself with good things, and every community is having a difficult time. And I know that the superintendent here in the school department has been working very, very hard, and hopefully they'll kind of iron this out a little bit and get it done. I know the parents are worried and concerned, but it's not their fault. It is not. It's just a very, very, very slow process.
Right. And I know that the school department did have a great first day yesterday, which we're all very happy about. They loved having the kids back into school. And as we expected, there was one positive at the middle school that had nothing to do with school transmission, had to do with the sports team. So that's going to be followed up on as well. So that's going to happen right now. And I think luckily, Elaine, the vast majority of these cases are mild-ish, I guess. So we're still, we're still doing well. So
especially in the children, you will see the children not even have symptoms, and it's so devastating. Sometimes I have to laugh at some parents. Will say they'll have it, and they go, I don't know where I got it, and then they go, well, I took the kid, and guess what? He has it, and the child is fine. But the cases that we are seeing right now are very, very mild, and that's what we're hoping. We're hoping that spread doesn't get into the vulnerable communities, and we're trying to keep everyone safe.
Yeah, and despite that fact, we're still looking at about 50 cases a week, so it is it is up. Thank you. On the vaccine front, Wakefield is at least 74.3% have had at least one shot. Which is wonderful. We saw a lot of increase, particularly in the 12 to 15-year-olds, which 3/4 of them have at least had their first shot. Great job doing the clinic. Great job getting your people out there. 16 to 19 years old or a little bit higher. I think that look at fully vaccinated too. Put the chart up. Really wonderful. So we are moving. It's still our 20 to 29-year-olds in town, but those having at least one shot, my numbers from the state are about 70%. So we're getting there. We're getting there really, really well. And I thought I would give you one interesting little tidbit on this before I go around to the panel. Apparently, it seems to me that you can get so much information from the state going on their website. Apparently, the male population in Wakefield, 70% of them, 70, has had one shot, and at least one shot. And it just appears that, as I've been told since growing up with three sisters, women are at least 10% smarter than men, and women in Wakefield are at 77%. So guys, we have some catching up to do. So kudos to women who are so much smarter than men. But in any event, we're doing everything we can. Please use these resources. I am also pleased that Wakefield has seen a lot of testing. 3,000 plus, are getting tested on a weekly basis. So that's really good. We're starting to get, people are taking this seriously. And with all this testings, our positivity rate is at 4.25%. But I think part of that is because people are being careful and they're going and they're getting tested. So I'm really I'm happy with that. Let me go around to our panel here. I see our chair, Julie Smith-Galvin, chair of the town council, who has been supportive on all of our efforts, and hopefully she has a a couple of words of wisdom.
My words of wisdom are to listen to these smart people on the panel. No, I mean, just emphasize it. Thank you, Elaine, for all your work. And transitioning our new health director, you stepped in at a really critical time, and we could not be any more grateful. And I would just say to everybody, take advantage of the beautiful weather and do things outside distanced if you can for as long as we can. My goal, our goal as a council is just to keep Wakefield open, to keep the kids in the schools and the businesses open. And whatever we all have to do as a community, we should do that.
Thank you. Thank you. That's why the outdoor dining has really been great for all the, I was out last Thursday night. I think I might've been the last Plaza Jazz, and being outdoors dining and listening to Plaza Jazz doesn't get any better than that. So it was really safe and well for everybody.
Yeah, I know we have some events this weekend that are outside, the ALS walk, the 9/11, let's please come out to those, but wear masks, especially inside, and when you're outside, keep distance and wear them if you want to.
Absolutely. Thank you.
And anybody here can count on me on any of
that. Laurel, we'll switch over to you before
I would just echo exactly what Julie has just said. Elaine, we can't thank you enough for.
It's been my pleasure and my honor. I love public health, and I won't be fading. I will be contact tracing, and I'll still be around to fight this off. This is something else. I lived through and I went through and worked through H1N1. So what's this? This is nothing.
Well, I'd say this was a little worse than our H1, but we have been together since H1N1, and, and we sure have learned. And I have, just again, we are so fortunate as a community to have a really deep team in the health department. We're just starting yet another grant, doesn't have, and that team has been able to sort of shift some responsibility so that we could dig down and keep up with COVID. I believe I'm getting on the contact roster, and we will, we will be doing flu, but we, just patience through this all. None of us like instilling more restrictions, but we're getting there. I mean, the good news is the vaccine is working. These people who have tested positive but have been vaccinated, that's the whole point. They're not sick. So we just have to get more and more of that. New England looks so much better. We just have to take lessons from the whole country. And I am really feeling fortunate that we live here. So keep up the good work, everybody, and be patient.
Thank you. Thank you, Laurel. Jen, anything to add? You put a couple of things up in the chat. Thank you.
Sure. Yeah. If you want to look at the Wakefield's COVID dashboard, it's www.wakefield.ma.us/COVID-updates. It's in the top nav of the website. You can access it. There's also in the top navigation an online payments button you can click if you don't want to come into town hall. There are a whole host of things you can do online. Also, all the town administrator licenses and applications and the health department licenses and applications all moved to an online system late last year. So there's a lot of things that you can do from home if you'd prefer. Again, we have the drop boxes outside, and we do contact trace. We were talking about contact tracing. We do that here in town hall. So if you do want to come, just don't be taken aback if you're asked for your name and phone number. It's just for that purpose.
Right. And it's really for your protection as a consumer coming in, not so much. Great, thank you.
Remember, wear masks in all town buildings.
Right. Exactly. And we have masks available. They're right out there, right out front for you when you come in. Steve Ingalls from the school committee saw a lot of happy young kids going to school yesterday. Big smile on my face, including my grandson, which I think was much more special to me than my kids were. Hopefully none of them are watching, but I think that meant more. So kudos to the school committee and to the administration. Do you have any words for us, Steve?
Yeah, it was a great day. My kids were among the happy ones. So I would just also say to Elaine, thanks for helping us out with all of this and for her service. She actually helped our son when he had some vaccine hesitancy. The little one, didn't want to do the shot, and she was at the field house I think helped coax him along with his flu shot last year. But to the school district in testing, I know that in speaking with Doug, one of the reasons that we're a little bit behind is because it's been so popular with a number of the districts. So I think that wasn't anticipated. So I think earlier we had hoped for the middle of this month. I think now it may be pushed out to hopefully the end of the month and not much further. And that'll involve the training and the testing kits that'll be necessary for the schools. So hopefully we'll be set up in not too long a time.
Great, thank you. I know that Elaine had said she's doing a lot of other things today, including it's her anniversary. So happy anniversary, Elaine, to you. And I owe her a world of thanks, and particularly for allowing me to twist her arm to help us through this transition period. So I think that's great. Other than that, all I can say is if you're not vaccinated, please go out and get vaccinated. That is our best method of getting out of this and getting really back to normal. Wakefield's been good. We could be better, of course. This area of the country has been good. It could be better. But, you know, if we can get those numbers up to, you know, the 90% across the board, I think we'll all you know, get the benefits of that in the long term. So other than that, if no one has anything else to add, I thank you for sharing a few minutes with us on Friday morning. We intend to keep these going for the foreseeable future, and we'll let you know. And to all those kids, welcome back to school and be safe. And to all the parents, you know, trust the school system. They're doing a fabulous job. Trust our Board of Health. We're all here to make everybody safe. So, and if no one has anybody else, have a great day and a great weekend. And like our chair, Julie Smith-Galvin, said, enjoy the outdoors, get the fresh air in your lungs and socially distant, and, you know, just enjoy that and try to stay out of crowded places. That's it. That's all I have. Anybody else? No? Have a great weekend, guys. Take care.
You
Bye-bye.
too. Thank you.